We're going to talk about either something that's called plugged ducts or clogged duct or a blocked duct and mastitis. So if you have ever breastfed or are breastfeeding, you have probably heard about these and are familiar with them. So many breastfeeding moms experience plugged milk ducts during their breastfeeding career, and they can be painful, but they are usually easily resolved. So I wanted to talk a little bit more today about what they are, what is a plug duct versus mastitis, and what are your treatment options for it. And so that hopefully it is not something that you have to deal with for a long time if it is something that you've experienced. So how do you know if you have a plug duct or mastitis? So a plug duct or clogged duct, you're going to hear me say that, and probably even blocked duct, generally comes on suddenly, and it's a firm, tender, painful lump anywhere in the breast area. And the lump may be warm or red to the touch, and essentially happens because the milk becomes clogged in the duct and it causes swelling and discomfort. And sometimes it can become infected. And when that's the case, then this plug duct turns into what's called mastitis. And signs of mastitis are pretty much the same as that for a clogged duct, but we usually have the addition of fever and a general feeling of unwell and malaise. Many mothers identify it as feeling like they've got flu-like symptoms, okay? And so we're gonna talk about what are some options when we're experiencing both of those types of conditions, whether it be a plug duct or mastitis itself. So some things to think about when we're treating a plug duct or mastitis is that ultimately we wanna start with treating the underlying cause and then also clearing the blockage. So how do we identify and treat the underlying cause? So I'm going to give you some examples of a few things that can potentially be causative factors for a plug duct. First is wearing really tight binding clothing, such as a bra that doesn't fit well. And so we all know that with pregnancy and postpartum, our body goes through a lot of changes. And, you know, with having a newborn at home, we may not have been able to update our wardrobe. And so we may be squeezing into bras that maybe don't fit us quite as well. So if you're wearing really tight or ill-fitting bras, we want to loosen up the bra or switch to one that's a better fit. You can even go in and get fitted at a lot of the lingerie stores for specialty bras that may feel more comfortable. The other main cause is that you may not be draining the breast completely when you are breastfeeding. And then, so we want to make sure that your baby is really nursing effectively. Breast compression or massage may help the baby completely empty the breast while you're feeding. Sometimes it can be as a result that you may have an oversupply of milk, and that can make it really difficult to fully drain the breast. So if you are suspecting that you're having trouble fully draining the breast, it is really important to figure out why and what are some changes that you can do. And in this situation, a lactation consultant is a wonderful person to partner with to help with this. Most of the area hospitals where you can deliver have lactation consultants available there. There are also some wonderful ones here in town. So if this is something that you are needing a referral to, please don't hesitate to reach out. I'm happy to give you some good names to go see. So I highly, highly recommend working with the lactation consultants to make sure that we are nursing effectively. Unfortunately, sometimes moms can get plug ducts without any particular reason, and they can come on fast, so no identifiable cause. And so that can leave you feeling a little defeated. But if you do have a blockage that comes on, there's definitely some things that you can do to help clear it on your own. And honestly, the majority of the time, a clogged duct will clear on its own within the first 24 to 48 hours. Okay, but here are some things that you can do to help clear that blockage. So one is to try and nurse off that affected side first, since the baby tends to nurse more vigorously on the first side, and that nursing helps to pull the plug forward. We need to clear the blockage out through the nipple. It also may help to change up your nursing position and try and position the baby's chin towards where the blockage is. So if we're dealing with a blockage on, I'm going to move my camera angle, on kind of this outside area of the breast. We want to have the baby's chin pointed back here. So we may do like a football hold to make sure that the chin is pointed towards the area where the blockage is. Now, depending on where the blockage is, you may have to get a little creative with that as far as positioning wise to make that happen. Another way is to do a dangle feed, where you nurse the baby while he or she is laying on their back and you're on your hands and knees over the top of them. And that's allowing gravity to help draw the plug through and out. So those are some suggestions as far as how to potentially affect it with changes to how you nurse. Before nursing, you may find it helpful to apply a warm compress just before you nurse or pump to help loosen up the plug. So either a warm, damp washcloth, or I like making little rice pillows. My favorite way to make them is just get a clean, dry athletic sock, put dry rice into the athletic sock, knot it up, and then you can just microwave that for about 60 seconds and then lay it on the breast to help with it. So that's a simple, easy way that you can make your own rice pillow for some heat before you do either breastfeeding or pumping. Massage to the area before or during breastfeeding or pumping can also be helpful. It also can be a little painful, I understand that, but it does help to loosen the clog a little bit. And you want to think about massaging down towards the nipple or up towards the nipple. You're always trying to get the clog to go out towards the nipple. So depending on where it is, you have to change how you massage that way. Sometimes doing massage with vibration can be very helpful. So using the blunt end of a vibrating toothbrush can be a way that you can do massage with vibration. If you have other things that vibrate at home, I'm going to leave that to people's imagination. You could use that as well. But so massage, warm compress, and changing your nursing positions can all be helpful things to make it to help clear that plug duct. Okay. This goes for whether this is mastitis or a plug duct. So mastitis usually will resolve with the above treatments, but if the symptoms get worse, you're dealing with more of a fever, more malaise, it persists after 24 hours, then you definitely do want to call your healthcare provider and probably need to get on antibiotics because of it to resolve the infection. Okay, so most people who just have a plug duct don't need to be on antibiotics, but if we have gone into full-blown mastitis, you may need to. What else can you do though if you're on antibiotics or it's been past 24 hours and things aren't resolving? So what can you do to help resolve a plug duct that seems to be persisting longer or is repeatedly recurring? I work with a lot of women who they're good for 1 or 2 weeks and then it comes back again, and then they're good and then it comes back. So another modality that could be helpful is doing what's called a therapeutic ultrasound. And this isn't something that you can do to yourself. It's something you'd have to go to a physical therapist who is trained in using the ultrasound modality. But the ultrasound waves can pulse the tissue at the molecular level and create this vibration that helps to, a really deep vibration that helps to break up the blockage. And so we see a lot of really good results in usually just 1 to 3 treatments here at Legacy, where women are coming in that have blockages that are persisting past that 24 to 48 hour mark. So if you've tried all the tricks that we've talked about above and that it's still not resolving, you may be an appropriate candidate for therapeutic ultrasound. So this would be a situation where it would be helpful. You can just give our office a call to talk to us about it and see if it's a good option for you, or like I've said earlier, contact your OBGYN or midwife, as well as talking with your lactation consultant to see if this would be a good option. It also may be helpful, especially if we're having some latch issues or your baby's having some nursing issues, that you may need to do some pumping with a good quality pump to really try and clear your breasts and empty your breasts at least once a day. Honestly, I'm a big fan of seeing what our baby can do, and the natural way is the best way with it as far as the suction created. But if sometimes our babies are having issues, and a pump that can give us that better suction might be the better option when we're trying to clear the blockage. Okay. A supplement that I often have recommended to people who are dealing with clogs and blockages, especially repeated ones, is something called lecithin. And it's found in health stores, and it helps to break down fat and clear the blockage. It kind of makes things a little bit thinner so things come through quicker. So some of my moms take this on a regular basis if they are susceptible to those clogged ducts recurring. Some just take it on an as-needed basis. So went through pretty quickly some of the various treatment options that we have out there. So if you are dealing with a clogged duct or mastitis, I hope this gives you some suggestions of things that you can do. But it is really important that if these symptoms aren't resolving, that you do talk with a lactation consultant and or your OBGYN or midwife about it. And we may be a helpful option for you as far as being able to perform a therapeutic ultrasound to really help some of those deep, stubborn clogs break up.